If I can ask you to please take your seats, we're going to get started with today's quarterly meeting. My name is Malik Nevels. I'm the Executive Director for the Illinois African American Coalition for Prevention. This is an exciting meeting for us. It's kind of off the beaten path. We historically or traditionally, we use these quarterly meetings as an opportunity to bring people we believe to be key influencers in the area of prevention to share with you some of their programs, funding, resources as it relates to building safer, healthier African American communities. Today we're going to do something a little different. It's going to be very interactive. It's our Speaking Truth to Power Advocacy 101 workshop. It's the first of what I hope to be a recurring annual quarterly meeting. Joining us today, and I'm excited to have her with us. She's going to lead us through this exercise, and she's been working with us over the past month to really develop these case studies, or we're not calling them case studies, I'm sorry, we're calling them scenarios, that each of you will be kind of working together on. Her name is Terry Johnson. And Terry is a nonprofit strategist who has worked and volunteered in the worlds of higher education, philanthropy, social services, youth services, human rights, public health, and advocacy. So she knows her stuff.
Looking at the long haul, because the work we're talking about doing is long and hard, and these are inspirational to me. But also, I wanted to remind us and to begin by reminding us that there has never been a moment in the history of African Americans in this country that we haven't had to advocate on behalf of ourselves. There's never been anything that happened good for us that we didn't influence in one way or another. So we know how to do this work. We know how to raise our collective voices to make change. So the first one is, how will this policy, if implemented, impact the African American community? Please don't just talk about the negative impacts. Try to find the positives. What groups within the African American community will be most impacted by it? Are there potential unintended consequences? What might happen even if it's not in the legislation? Does the community know enough about the issue? And if they don't, what information do you want them to have? And then finally, is there a conversation already going on in any of your circles about this issue? And if there is, what's it sound like?
The first thing that we discussed as a group that we would do in terms of community would be to identify the leading stakeholders in the area. As a membership organization, the Illinois African American Coalition for Prevention has a significant number of individuals under their umbrella, so they could essentially be the education piece for that membership.
We talked about informing the community because we wanted to be able to take members from the community with us when we went to go meet with the legislature. So we didn't talk about specific strategies the way that they did, but we basically talked about how we would need to inform the consumer, the community, about what the issue is and what the benefits are when we talk about what the healthcare disparities are for African Americans, because that's primarily what our community is.
We did like a 5W, like who, what, when, and where, as far as who, what, when, why, and where, as far as what do we want people to know. So obviously the particulars of the bill, who wrote it, what it is, how it will impact you, and as far as how things stand now previously is, and the changes that would ensue after.
As decision makers, we have a number of concerns. And we want the message not only to go to the elected official, but also to the roots where the need is and why much of this legislation has been generated.
All I want you to do is tell somebody today about the policy issue that you explored today. Because I guarantee, and a lot of people, you all said this, they don't know that this is happening. And our first step is to make sure the community at least has an understanding about it, because this is going to happen whether they know it's happening or not.
The most important takeaway that I've gotten today is the importance of collaboration, and that there's an organization that is intentional in bringing groups together that have similar causes or similar concerns that all lead to prevention.
I learned a lot today in terms of advocacy. I want to actually reference a Bible text that says they made it over by the word of the blood of the Lamb and the word of their testimony. And there is no greater testimony or no greater truth than to actually having people who have walked that walk speak for an advocacy initiative. So I think it's really important that we continue to really harness the power of the community and allow them to be the voice of whatever we're championing, because those are the people who the legislators actually want to hear from. They want to hear those stories. They want to see where the bills and the laws are actually impacting and how the community is actually benefiting or not benefiting from them, so that they can craft additional laws.